Rush Limbaugh says if health care reform passes, he's going to leave the country. Thereby, for the first time, making me excited about the possibility that health care reform might pass. But he's going to say something awesomely stupid while making his point. So let's go to clip number 9 here.
Two-part question for you regarding health care. If the health care bill passes, where would you go for health care yourself? And the second part of that is associated with it is, what happens to the doctors? Do they have to participate in the federal program, or can they opt out of it?
Well, in the first place, none of that's going to happen for 4 or 5 years.
Yeah, I understand that, but if it does, what happens to the doctors? Are they going to be forced into a federal program?
Yes. They're going to be the only people providing insurance.
Where then would you go for health care?
Where would I go for health care?
Yeah, if the private doctors have to go into the federal program.
My guess is even in Canada and even in the UK, doctors have opted out. And once they opt out, they can't see anybody, Medicare, Medicaid, or what will become the exchanges. They have to have a clientele of private patients that will pay them a retainer, and it's going to be a very, very small practice. Now, I don't know if that has been outlawed in the Senate bill.
Okay.
I don't know. I'll just tell you this. If this passes and it's 5 years from now and all that stuff gets implemented, I am leaving the country. I'll go to Costa Rica.
Yeah, two-part question for you regarding health care.
Oh, you're going to leave the country? That's awesome! All right, let's go, Obama. Let's go get him. All right, now here's the fun, stupid part. Costa Rica has nationalized health care. I go to Costa Rica. Well, he's not that wrong on the quality of service he'd get in Costa Rica. Average life expectancy is higher in Costa Rica than it is in the United States, which is unbelievable, right? And their income is about 1/10 per capita of the United States income. 1/10. Yet their healthcare system is excellent and by some measures outperforms ours. Why? Nationalized healthcare. And that's not just nationalized insurance or a public option or Medicare buy-in. No, that's weak sauce. Nationalized healthcare. So it would be rather ironic if you left the U.S. and went to Costa Rica for their private medical system. Now, by the way, they do have private options as well in Costa Rica, and that relates to his earlier point. And the poor schlep who's calling in and saying, Rush, are they going to take my doctor away? Where would I go? And Rush goes, oh, absolutely, they're going to take your doctor away. Except I don't know if that's been outlawed, because it hasn't. Of course it hasn't been outlawed that you can't see your doctor if you're on private insurance if this thing passes. First of all, the public option is not even in it. I don't even know what the hell they're talking about. It's the same exact system as you had before. But Rush and his listeners are not that attached to reality. There is, one of our listeners, Tony Daughtry, wrote in with a good point here. He's the first one to point that out before the rest of the blogs even caught on to it. The fact that Costa Rica has nationalized health care. And he added something else. Costa Rica does have something Rush is interested in. You know that Rush is rumored to partake in sexual tourism, as they say. You know how he goes with his gallon of Viagra to some Central American countries and then went to the Dominican Republic once. Costa Rica, apparently fairly well known for sexual tourism. Take your gallon of Viagra and head on over there, Rush. Nobody will bother you, man. You take those OxyContins, you take those Viagras, nationalized health care in case you have one of those fake heart attacks again, you'll be all set.